Wonderful. Thank you, Puneet. So what I'm going to do is I'm just going to start again and just give a little bit of introduction.
Yeah, okay. So we've started the live video.
Yes, I have. All right. Yeah.
Yeah.
Cool. So I'm just going to initiate the why we are doing this. First of all, what's the purpose of coming together today and having this discussion? Today, 3rd of December, is the International Day for People Living with Disability, IDPD Day. And this day, we acknowledge all the hard work and the impact of living with disabilities and how it affects the quality of life of individuals, but also the family and the carers and the family members taking care of or supporting the people with disability. Disability means different to different people, and it's dependent on what kind of disability they are living with, and what are the challenges and the complexity of that disability they are living with. But Puneet, the main topic today and what we chose today is talking about invisible disabilities, because I thought that this would be really apt and in line with what Muskaan Care Trust has been trying to establish and struggling in New Zealand, being a developed country. A lot worse than dealing with the disabilities, the invisible disabilities in the countries, as our motto and as our mantra is ensuring no one left behind, and every New Zealander has the right to live like other New Zealander who does not have the disability. So, as I was saying, invisible disabilities. So, Muskaan Care Trust has been diligently working towards thalassemia care and support, sickle cell anemia care and support, but also looking into the chronic health conditions like depression and the diabetes, heart health problems, and all those different disabilities or health conditions, long-term conditions that actually hamper the day-to-day living and the quality of life. So Puneet, this is what we will be discussing today. So thank you for joining us, and just give a little bit of introduction once, and I will give my introduction later on. This was for Muskaan Care Trust and why we are doing invisible disability discussion. So over to you, Puneet.
Thank you for having me here. Um, I'm Puneet. My name is coming up as Javneet, but that's a different name. That's my Zoom ID. It's not that one. So I am a doctor from India, and I moved to New Zealand. And yes, you are being my mentor. Nivedita ji is being my mentor so far and guiding me throughout my journey in New Zealand. And yes, I love working with her and what all she's doing for Muskaan and Muskaan Care Trust and for the community. It's a commendable job that you're doing. And yes, I would love to discuss more about this topic on disabilities today with you. I think it's a I think it's actually a golden term, which is which is invisible to the community. So let's talk about it a bit more and make everybody aware of it today.
Thank you, Puneet. Thank you. And when we were discussing offline, you mentioned that this is the first time you heard this term, invisible disability. Yeah.
Yes, yeah.
Yeah.
But
And
this is I think it everybody knows about this, but I think we need to surface this term a bit more.
yeah, I agree with you. And that's the purpose of this Hui today. And it's just about creating awareness. I just briefly say, Kia ora everyone, and Namaste, Sasrikal, and warm greetings. I'm Nivedita Sharmavij. I'm one of the volunteer at Team Muskaan, just like Puneet. She's very kind, saying some nice and kind words, and it's just about sharing and caring for each other. And I have been a consultant and advisor for Muskaan Care Trust since its inception, one of the co-founder for Muskaan Care Trust, because it's a lived experience, but also looking and working in health sector in the social, social economic sort of challenges within the community, the migrant Asian, South Asian communities. What I observe, where I see the gaps, I try to address it within the community and to the mainstream public services and other people who are passionate and really keen to do something about it. So that's how we started, and हम चले तो लोग जुड़ते रहे और कारवां बनता गया. So इसी तरह the passionate people like Puneet and the other volunteers, I won't name everyone because then it'll be a big list, but we are very grateful for having these heart on the sleeves people who are in their busy lives, the young families, and taking care of their extended families. They still devote some time and sort of support what the work Muskaan Care Trust is trying to establish in New Zealand. That is the advocacy, education, awareness, empowering, equipping, the people living with invisible disability, thalassemia, and sickle cell anemia. So the word itself, Puneet, explains invisible. So invisible means that is not seen by others, that is not visible to others. And that's why, these conditions actually go quite unnoticed, unspoken, undiscussed, and unsupport. That there is no support, there is no kind of a framework around these disabilities, because people can't see it, and usually you see what you get, right? So that's why I call this group a very vulnerable and disadvantaged group as well, because the loss of stigma is attached with these invisible disabilities. People don't want to talk about it. And the person who's going through these invisible disabilities, they do not want to talk about it, even address it. And it take long time for them to actually get out their denial and accept that they have a problem and they are living with a disability. For instance, depression, people with mental health conditions, people with mental health challenges, and all these anxiety, panic attacks, depressions. People don't people are not able to understand what all is going on, and that's the nature of the disability, because in depression things are happening around you and within you, but people are not able to see through, and they get confused why it's going on. So for example, I'll give you my example. You're just sitting, you're so stressed and you're so like going through, you just feel like crying, and you don't know the reason why you're crying or why you want to cry. And hibernating sometimes when you're really full on things, you have so much going on your mind, you just hibernate, you get into your under your blanket and you kind of make yourself invisible, that what if somebody noticed that things are going on with me. So over to you, Puneet. Have you like experienced, or you have seen something like that around you in your career in India as a doctor, but also here in New Zealand?
Yes, there's a lot of importance on mental health over here in New Zealand. Yes, I have faced it myself at times, and in our day-to-day life also we keep on experiencing that. But we are like a bit hesitant, like there were ups and downs, and we feel low and feel like crying the way you said. Yes, so even we don't realize we are going through something,
Mm.
and I think we are always in a phase of denial that we are going through. Like we don't accept what we are going through, and that discussing it our problem with someone comes a very later on in our stage. Yeah, because we feel it's a stigma discussing our hidden invisible disabilities with somebody.
Right. That's very true. And I think it get
Yeah.
worse. It get worse when people around you also don't understand what is
Hmm.
going on, right? So,
Yeah, just now I would like to add something over here. Like when I was going through that, I just Googled like to read more about it on invisible disabilities when we shared it like some time back today.
mhm,
So I've lost that link, but there was something that 10 there were 10 lines which we should not tell somebody who's sick or having invisible disabilities.
Mm-hmm.
So I can't remember all of them. Like I think I wish I could have saved them, but I'll share them if I find them next. But one of them was we should not tell anybody, like if at all somebody comes up and shares with that I'm going through this thing, then we shouldn't be mentioning that, oh, you seem to be fine every time we saw you, something like that. So I
Mm-hmm.
think it was written that we shouldn't be saying that to somebody. It's not a kind
Yeah.
thing to say.
Right. Yeah.
I thought I will share this with you.
No, that's wonderful. And it's very important to actually
Other
bring.
person will feel bad. The other person has gained courage to discuss his um, thing with you, his problem with you, and we can be a bit more kinder in our words, and rather than saying, "No, you looked fine every time," or "You've been fine so far. Every time we saw you." Yeah, that could be improved, and being empathetic and kind to people who are going through disabilities. Yeah, it's very important.
It's very important. So, do you think we are having a start with this discussion? Maybe, people are not able to join us today, but if they'll hear and, go through this talk, or they decide, okay, let's see what we have discussed, it can actually help open the channels in a way that people can actually, you know, start thinking about
Yes, I think
their their own experiences or how they are feeling around it.
yes, because it attracted me when you told me about this. I was keen on joining this session today because I wanted to discuss more about it. So maybe other people also think like me and they want to join next time.
Absolutely, absolutely. And as I said, we are actually having this is on YouTube, but it's not going to be published to the public. So we can actually share this recording on request if somebody wants to actually, have a bit of start with some protective password. Just because, sometimes even you and me sharing some of our personal experiences, we don't want to it to be talk of the town. It will be, very secured sort of release of this, and as a motivating conversation, as an inspirational conversation for someone who may be hesitating to talk about, their disability, or some of the signs and symptoms, they are experiencing when, with that disability. So I just want to share this little slide of mine here. If you see, can you see that?
Yeah.
Yeah. So these are like some of the, signs and symptoms which we sometimes misjudge because, thinking that, oh, I may have tummy bug, or I may have a, problem. I may not, I may have picked up a bug or something like that. But if this is happening quite, often, and it's there, it could be a sign your body is trying to tell you that something is not right, right? And I'm gonna share a list of invisible disabilities, sharing in terms of what actually comes under the invisible disabilities, right? So by saying that, let's so what do you think, Puneet, is coming under, like what conditions do you think would be like coming under invisible disability? We talk about depression or mental health. What other things you think?
I think it's a wider term, it's an umbrella term,
Hmm.
and there's so many things coming up in my mind.
Yeah, such as.
First of all the mental health problems, depression, anxiety, post traumatic stress disorder.
Hmm.
Other than that, taking Muskaan's example, blood disorders could be unidentified.
The
Um,
lack of awareness and due to ignorance, yes, people do live with them for years. Yeah.
yeah, it could be some neurological disorders like epilepsy.
Mm-hmm.
Somebody is having that, and it's only surfaces when one has the first attack.
True.
It
True.
could be diabetes,
Yeah.
it could be uh, gout,
Yeah.
joint problems, bone problems,
Yeah.
could be
Absolutely.
malignancy,
Yeah.
which is it could be a malignancy which is has started to grow in one's body,
That's right.
started on its starting phase.
That's right. And that's the thing, because in such invisible disabilities, people have all their limbs and body form intact.
Yeah,
So it's not like they have lost any vital organ or any limbs and things like that, which is kind of visible to people. And people can have like hidden spectrum of hidden disabilities and the challenges related to that, such as extreme fatigue, which is one of the sign for thalassemia and sickle cell anemia as well, that you are fatigued all the time. There is a tiredness, sense of tiredness. There's a dizziness because of low iron levels and low hemoglobin levels. There is a chronic pain all the time. There are cognitive impairments, like having difficulties to make some decision making, and comprehending the information properly, or even being able to make some decisions on the spot. So those cognitive impairments. And it could be sleep disorders, like people are not able to sleep well, as I said, chronic pain, the chronic illnesses you mentioned, diabetes, it's a heart problem, cancer. So until unless somebody don't tell you they have cancer, you cannot, see on their face or on their body. You may see that they are going down in their health, but what's the reason? It could be birth disorders as well, during the birth, like, FTST, like fetal alcohol facade. So, a child born with that alcohol related complications when mom has been drinking during the pregnancy. And sorry to say that, but the child born with facade is like, it's a disability right from the day child is born, just like the child with thalassemia. They are living with that disability the day they have their first breath, in this world. And also to mention, as I said, sleep disorders, but there are other examples as well. So lots of mental illnesses, like you mentioned, depression and, so the PTSD, the post-trauma syndrome, and schizophrenia and other sort of mental health problems can be extremely difficult. And usually what happens is with these invisible disabilities, the people, and I'm saying from cultural and community perspective, the families try to hide the person rather than do something about that disability, and sort of that try to cover it up due to the stigmatization of the mental health and taboos we have in our community. And you will agree with me on that, Puneet, because it's very hard for the person who has that, and going through complex depression or mental health issues, to actually accept themselves. And it get worse when the families also deny and do not look for the help and support to the person, rather try and cover. And this is what I've seen in my experience as a health professional, as a White Ribbon Ambassador, and in my JP, Justice of the Peace capacity as well, where people are contained and closed and locked in the rooms. So rest of the society or family members or extended family doesn't get to know, but also blame that person, that, it's bringing shame and it's bringing embarrassment to the families. So over to you, Puneet. Have you experienced something like that or seen something like that out there, where things has been denied, not accepted by the person, but also their family members or the loved ones, where we expect them to, nurture us, especially the young ones or kids and children and even elderlies, going through those cognitive impairments with blamed and abused rather than support and seeking some help.
Yes, I think it's very common. I've seen in all the our community. I've noticed this, but yes, if it's in our community, then it will be prevalent in other communities too. Wouldn't like to exactly mention the example because you might be knowing that some something happened last year in one of in our community, and it was a postpartum depression. And I think why the family did not support her, and ultimately with little one, that female committed suicide, I think. And
That was really, really saddening here.
yes, like I think looking at her, like I could relate, because I think her child and my child was the same age, and had committed a suicide when her child was 1 year old, and same was my child too. So I can relate, like a female after postpartum depression is going through a lot.
Mhm.
But the way that happened and the news came out, it was really heart touching, and I think I can never forget of that incidents.
Likewise, likewise.
Yes,
And
but in that situation, sorry, I did interrupt you.
carry on, carry on.
I think that that issue should have been discussed with the family, and rather than taking it as a stigma, it should have been explored a bit more, um, discussed a bit more, and not taken as a taboo. And that female should have given a lot of that at that point she should be provided with that much of support and treatment, that it doesn't end up in a suicide like this.
That but exactly that was my going next question was to you, that what could have done differently, if we would, if we could have saved her, what could have done differently that she was supported and taken care of, so I'm talking about the different levels, what could have done. And why I'm saying that, because if somebody will see and hear this out, maybe they get inspired and sort of be able to recognize it in first hand.
What could have been done was, there were two important things.
Mm.
Number one, I would say, was the family support.
Mhm.
Number two, I would say, is the medical treatment. And I wouldn't say one is more important than the other, but both are very important. If I would have, I have to have chosen one thing over the other, that is family support. As a person, I'm saying, being through that postpartum phase, I would say it is the family support. They should understand what she is going through, because she is a new mom and she hasn't been a mom before, right? She needs that kind of support from the family, from the husband, from the in-laws, and everybody staying in the family, because that is just a phase. And with that support of the family, we can uh, tide over that situation, that tide over that period of time. It could be 1 year for somebody, it could be a few months for somebody, it could be 2 years for somebody. But with that strong family support, I think every female can overcome that phase.
That's a very good point, and Puneet, but I'm just going deep down there because I myself has been, lived experience of postnatal depression after my pregnancy, and I cannot relate with what all was going in her mind, but I could relate with something and can identify the place where she could have been, right? But at the same time, it's how you deal with that at that time is not important. How you are being supported around you is also equally important, like you said. And also the education and awareness amongst the families, because as we are discussing that it's been stigmatized, but not realizing that a girl turning into a woman when she is pregnant and deliver a child, There are so many changes going on, psychologically, physically, mentally, environmentally, overall, it's a transition from one point A to point B. And
Hmm.
and there's a lots of physiological changes going on. And I'm talking about the hormonal changes that's on play when a girl or a young adult is pregnant or a woman is pregnant. And lack of awareness and ignorance amongst the family and comparisons, and I'm talking about like senior members of the family. There is a comparison that we have done this and that when we were pregnant, and and there is more like a accusing to the girl who's transitioning into woman. And it's like, you should be coping without realizing your time, your circumstances, and things were very, very different. These days, girls are working, they have their pressures, they have their own stresses, and especially a country like New Zealand, where everything is done by yourself. So you are the by, you are the my, and you are the समटाइम ना ही as well. मतलब कहने की बात है कि सब चीजें खुद से होती हैं, and our culture and our tradition, again I'm bringing that woman should do, घर का काम is औरत का काम, not a boy's काम. And अगर boy is helping तो mamas raises eyebrow कि ओए, you know different kind of. So I'm just saying that it's not the woman go through that, but also man, young adult boy turning into man, during when they are expecting a baby or starting a family. So that lack of awareness sometimes further stigmatize with all go happening in the body, in the mind, and in the, in the wider sphere. So even somebody wants to talk about, what all is going on. This is kind of pushbacks you get from your very, very intrinsic, environment. And I think that's what I heard from many, many young girls, like, a woman getting pregnant first time. And even the postnatal depression is not discriminating between first, second, or third pregnancy, because every time a woman go through change, right, a huge change, it's a turmoil of changes happening in in a woman's body, in a woman's mind. So it's a lot to take on for a person.
Yes.
And then, nurturing a life within yourself, itself is it's a huge positive thing, but also a negative, because that make you fearful, apprehensive, and so many things. It's a amalgamation of thoughts happening in your mind and body and everywhere. It's just too much. And honestly, I cannot imagine what was going in her mind when she took her life. But I can just imagine that she would have been numb to the extent that she haven't thought what she's leaving behind and
Yeah.
why she's going away. So I just cannot even comprehend that moment in my
I
mind.
think it has been more than a year, but still it looks so fresh to me. And every time I think of her, I am just shaken inside me.
Mm.
Till now, today, even now we're talking, I can still go back and think of that when we heard the news.
Yeah, but what do you want to say? The changes I have explained, like when a girl is transforming into woman, or a woman
It's
is carrying another
like
life.
this. Yeah, it's a huge transformation from a girl to a woman. It's just like we study metamorphosis, and there's a small egg turning a caterpillar and into a butterfly. So I think suddenly a small egg is turning into a butterfly. It's a
True.
very quick transition.
Mm-hmm.
Yeah. I think mm, I think that that incident at least has brought some awareness in my family, because when they got to know about that, then we had a discussion at home, and then I told that there's a term called postnatal depression, and I think she was going through that,
Mm-hmm.
and that's how they it strike their mind. Okay, there's something called postnatal depression also. So I feel if it has that. I don't wish that was the way to
It
make
shouldn't have
create.
it shouldn't have
It
come
should
this
have
way.
been a different way of creating awareness,
Hmm.
but that incident has brought awareness in elders, in the minds of our elders in my family, and I'm sure it has striked other families as well, and they are aware of this term also now.
I
I wish there could be
understand.
a better way to bring awareness, but still we can keep going and bring more awareness about it.
I totally get that. And also, it doesn't have to be that hard way. But the thing is, and that's human nature. Only sensitive minds and hearts remember things for a little longer. But when you're not into that shoe, it becomes the talk of the town for some time, and then people forget. It's a human tendency. People forget about because it hasn't happened to me. It hasn't happened to we. It hasn't happened somewhere out in the world. Yes, you sympathize. You maybe a few sensitive people like us may discussing this incident even after a year because it has impacted us and made us think, what can we do as community, what we can do as women to actually address this issue, and at least we can say that we have gone through those changes and that turmoil of changes in our life, and what can be done differently, so we don't learn hard ways when these
Yeah,
incidents like that happen. What could have done differently, and who
I
needs
think
to do that.
okay. So I think now, so we've learned it the hard way, so we don't have to have any other female go through this again. In any, like, I would like, my initiative would be like every of my friend, everyone I know of who's going through a postpartum phase, going through pregnancy, I think I will go and talk to them and make sure they're okay. And if they need some ears to talk to, so I think lending those ears is also a big deal for a person going through so much.
Mhm. True. So I will share what Muskan has been doing in this space since last year, but I would like to ask you, what do you think Muskan Care Trust can do or contribute to help and create that awareness in the wider communities?
Um, I sorry, going back, I remember you when this incident happened, you spoke quite openly on Facebook regarding this incident. So I do remember your Facebook post and all. Yeah. So I really like that you discussed that so openly. Sorry, I wasn't aware what you have been doing for that so far, but I know definitely you must have been doing something on the back end because I know you.
As per you, what you think we should be doing, like if I
We
take
should,
your brains, yeah.
yes, I think we should be bringing the community together and uh, creating more awareness in amongst the family members that if they have a daughter or a daughter-in-law or any young woman in their family going through this, this could happen. So because of the hormonal changes, so I think make creating more awareness regarding this.
Yep.
Yes, yeah. And the other thing is, I think we need to provide them, the young females going through this, through support groups so that they can talk. And that has to be, I think, confidential
Yep.
without any judgment.
Perfect. Yep.
Yeah.
What else?
Mm, that's all I can think of now. I'll pass it on to you.
I'm putting you on the spot, right?
Yes.
Yeah, now I want to just pick your brain because you have recently become, a mother of a beautiful Avir, our little mama's helper, cutie pie.
That's
Yeah,
why I'm
so
stressing on the importance of family support.
yeah, no, absolutely. And sometimes I'm not saying depression, but going through stresses, you have a wish list. I wish, this happened. I wish this could have done. I wish, somebody like, so I want to know your wishes when you had a bead. Avir, when you delivered Avir and you got it in his arms and then get back to your normal life. I know we have 40 days resting period uh, after pregnancy, which most of the girls, I'm not saying all of them, but some of them were still able to rest for those 40 days ritual, which is great. I love that ritual because that gives moms a little bit of time to
Yes.
recover and recoup, but dependence. So when you were back to your stresses of your day-to-day life, what were your wishes?
Though I'd got quite a lot of family support, but
Yeah.
still, I was in that stressful phase. Like, I would like to cry.
Mhm.
I wanted to cry all the time. Oh, hope this would have been this way. Hope this would have been this way. Um, hope my mom could be here. That was my wish. Because my mom couldn't join me during my birthing, so I wanted my mom could be here for me. Like back home, I could be in India. I could have that all that resting phase of 40 days, and we have a ritual there back in India. That the lady used to come at home and give you all the massages for you and the baby. I wish I could have that here.
Mhm.
So I missed all of that, and though I know,
You can go on, be open. Like, it's I'm asking about a wish, it's not everything is gonna happen, but it's like, as a
yeah,
new mother, what were your wishes?
something like I somebody could pamper me because I've given birth. So wanted all of that. So not all of that happened, but yes, though my family, I should be thankful for my blessings. But there were fishes, and it's a stressful phase. Sometimes you have everything, and in that stressful phase, you still want more. You're
Mhm.
still complaining, and you're still crying. So all that kept happening. Oh, hope I had this. Oh, hope I had my mom. Somebody could pamper me. Somebody could feed me with good food. Oh, hope I don't have to prepare my food all by myself. Somebody can come help me with taking care of my baby. All of that.
All of that.
Yeah.
Yeah. So I can sleep because sleep deprivation
Oh,
is one
yes. Oh,
big.
yes. I wanted to sleep because after baby, I think I still have not gotten back to my actual sleep routine.
Yeah,
He's gonna be 2 years, but
I
yes,
agree.
I still feel like I get up at 9 o'clock or 10 o'clock and sleep for have a sound sleep for the whole night. That's hard. So we just I feel moms are like I used to hear that moms are strong, moms are blessed, but now I can feel that in myself that God gives you the strength to cope up with all your multiplying responsibilities.
Yeah,
Yes, we become strong.
absolutely. And that's the truth. But I would like to add, thank you for sharing that because I think it's very valuable because it's you're going through a lot. Taking a life out of yourself is big, it's huge. And I know it's happening for decades or centuries, and since the Srishti has begun. But again, it's for every individual, they have their own capacity, their own capability to deal with stresses. And they're not everyone is blessed to have, that level of support you had. And some are really blessed to have, a higher level of support. Depends, what their circumstances are and where they are. It's different in India, it's different in New Zealand. uh, but I would like to add, Puneet, we are talking about postnatal depression. There is a prenatal depression as well. And I have worked with moms who were actually going through their pregnancies and they have this prenatal depression, prenatal stresses. And why I'm bringing that up, because when you're stressed while you're carrying the baby, your stress passed on to your child as well, to your baby as well. All right. We know that the stress induces certain hormones, right? And that hormonal imbalance, and this is for anyone who is having issues with high blood pressure, diabetes, or any other hormonal imbalances. you know what's happening is that those hormonal imbalances affect the child's growth and child's development as well, right? So it's very important to identify these stresses, identify the signs of depression, when you are pregnant, not pregnant, or, you deliver the baby and after that you have that depression. It's absolutely okay to feel stress, right? So what I would like to say is, and whosoever gonna see this, and Puneet, with you as well, address your stresses. Do not let pile on with your stresses, okay? And talk to someone, because sometimes the venting, having a ear, someone lending you a ear and talking to and sharing how you're feeling, in a no harm safe space is very, very important. And there are lots of help available in primary care at the moment. So I would encourage people to actually contact their GPs and look for a support of health coaches or health improvement practitioners based at GP practices. And at Muskaan Care Trust, we are trying to establish the similar model. So I said I'm going to share. So I'm working on setting culturally appropriate support for pregnant moms and post-delivery moms to come together as a group, so connecting with one another, like you may have some solutions for the challenges someone is struggling with, so it's like a peer support to each other, so bringing the moms together so they can actually talk in a closed environment, in a safe and private environment. Everything is confidential. It's not becoming talk of the town, and it's being understood because the other person is also going through the similar situation or
Yes.
similar condition. So very valid point. So that's what I have been working on with other couple of health professionals. We are looking into creating that hips and health coaching support for pregnant moms, who are pregnant and nursing, breastfeeding mothers with the child up to 2 years. And it's very important because the first 1,000 days of child is also very important. So as I said, somehow mom's stress to inculcate and pass on to child. All right. So the child, the little baby, deserve your love and your affection and your care, not your stress. Right. And also looking into tele support as well. So we can actually be able to sort of sustainable tele support where people can just pick up the phone and talk to someone if they need to. At the moment, we're looking into a voluntary space because we don't have resources, but we would like to actually start it and show the mainstream providers that this is helpful, and this is the impact this support can have if we have a consistent, sustainable support. So there are lots of sort of, activities or actions within that framework. But again, the one who's bringing life in this world needs all the life, and all the support and care to nurture having a girl turning into a woman. So that's why it's a very good discussion. But coming to thalassemia and sickle cell anemia, Puneet, do you have any suggestions? What can we do in terms of addressing these invisible disabilities?
I think I wish a few people can join us next time so that we can bring awareness among them. And
Mhm.
like you've been talking a lot about thalassemia and sickle cell anemia, and I have also realized in my past few years that yes, people are getting to know what thalassemia and sickle cell anemia is. So talking and being patient and keep going is what we need, and we need to keep talking to the community and make them aware because now, as you mentioned, people are getting themselves screened, so we need to make them aware of about invisible disabilities too, so they can get aware and talk to, at least look after their family members and get themselves um, tested for invisible disabilities from their GPs, because I think invisible disabilities are way more uh, prevalent than visible ones.
Visible. Yeah,
So
they are there. And that's the truth. 96% of people living with invisible disabilities don't know that they're living with that disability. So very, very well said point. But also, as I mentioned, that we are working with not just the communities and people, because that's a ground up approach. So wherever we are doing, Muskaan Care is doing workshops or seminars or forums or webinars, we are encouraging people to get screened. Don't wait for your doctor to tell you that you need screening or you may have this. Go to your doctor and say, I have attended Muskaan Care's forum or workshop, and I want to be screened for thalassemia and sickle cell anemia because I feel I'm at risk population. And recently, a fourth year medical student actually rang me and left a voicemail message because I was busy working. I work full time. He left a message saying, ma'am, you did a workshop on thalassemia and sickle cell anemia. I have put my name for special interest and group for thalassemia and sickle cell anemia. And we got this chapter in our curriculum as well, in the medical student curriculum. So which was a great pleasure and great satisfaction for the work that, while we are training the current doctors, who don't know what is thalassemia and sickle cell anemia is, but the future medical professionals having that understanding, and they will be proactively actually screening the New Zealanders, the at-risk New Zealanders with these conditions, and help Muskaan Care Trust to prevent the child or children living with thalassemia in the future, because knowledge is power, and having discussions and ability to talk to someone is a bliss. And we really encourage everyone to tap a shoulder and talk to someone. If you don't have anyone, give us a ring, PM us, or get us on WhatsApp. And you can DM us on Facebook. One of the volunteer will get back to you. And we are really blessed to have some really good people connected with Muskaan Care Trust. So thank you so much, Puneet. It's been a great discussion, but it's not end of it. It's to be continued, and we will be actually having more discussion. Just a quick one. We are starting, Muskaan Care Trust is starting Hope with Muskaan, which is healthy option positive eating online. And there is a link for our program on our Facebook page. So do join us for the Healthy Options Positive Eating and Prevention program from diabetes. If you're living with diabetes, it's a lifestyle modification program. You will enjoy the information, and that will be supported by the Hope Champions. Puneet is one of our Hope Champion, and she's volunteering with Muskaan Care Trust, and myself as well in the background supporting diabetes along with Diabetes New Zealand. So do join us, and thank you so much for seeing it, hearing it when you have time. And with this, we'll sign out. Thank you, Puneet, for your time.
I have a question. Sorry, one last moment. Can everybody go to their GP and request for a thalassemia or sickle cell screen?
Yes. And if somebody
there has to be some indication.
If somebody deny that, just let me know. I will tune it up.
Okay.
Yeah.
So much. And there has to be no indication to get yourself for thalassemia and sickle cell screening.
No, you can just say, I want to be screened for it, because we know we have at-risk population. So, the Asians, Southeast Asians, South Asians, Mila, refugee, migrant group is as a high risk population. So we really encourage, but it's not limited to that particular ethnicities because of the cross culture, things.
Yes.
Yeah. So Shambhavi has joined us, and what I'm going to do is I'm going to start the Hope program now. So we'll just sign out from here and join the Hope one. Okay.